Well, hello to everyone who's in attendance and to those who are watching the recording. I want to thank you for joining us today for our webinar on ethics in the clinical setting. I'm Dr. Leah Jeunnette. I'm so glad you could join us today, and we'll go ahead and get started. So just briefly to cover the agenda, we're going to talk a little bit about Case Western Reserve University and the School of Medicine, where we're positioned on campus. We'll then go into talking about clinical ethics and the discussion around that. We'll talk a little bit about our program, the master's program, and do an overview, and more specifically about the clinical ethics content within the program. We'll talk about the application and process deadlines briefly. We'll talk about student assistantships and financial aid, and then Q&A at the very end. So speaking of Q&A, if you have questions throughout the webinar, you are welcome to submit through the Q&A feature here on Zoom. Go ahead and submit throughout any time during the presentation. I'll keep an eye out and I either will answer it as we go, or I'll wait till the end and answer some of those Q&As then. All right, so just a little bit more about myself. As I said, my name is Leah Jeunnette. I'm the Assistant Director of Education and a Senior Research Associate in the Department of Bioethics. I'm also a clinical ethicist at University Hospitals Cleveland Medical Center, which is right next door to Case Western Reserve. I'm also a master's program alum. I did this program about 15 years ago, and I am delighted to be back on the other side of the program now, working with students. My background is in bioethics itself. In addition to the master's, I also have my PhD in the field, and I really like to focus in on clinical ethics and adolescent health as well. So let's talk just briefly a little bit about Case Western Reserve and the School of Medicine. So just for rankings purposes, the School of Medicine is ranked #1 in Ohio, and we're 24th in the US for medical schools based on research initiatives and those kind of things. What I really want to highlight, though, is not only is our Department of Bioethics in the School of Medicine, but we work across the university. So while our department is based in the School of Medicine, and we do a lot of collaborative work within our department and across the School of Medicine, we also collaborate across the university. So in the law school, in the Mandel Social Work School, in the College of Arts and Science, just lots of different places across the university. And we also collaborate significantly with our affiliate hospitals, which we'll talk a little bit more about those hospitals in detail later on. But they're all great partners, both in terms of education opportunities, in terms of research opportunities, and in the clinical opportunities for our students. So it's a great place to be positioned within the university itself. So that being said, I want to shift us to talk really about the main topic of this webinar, which is ethics in the clinical setting. You know, it's amazing to me, and because I live and breathe clinical ethics for most of my job, right? This is something that I'm quite familiar with, but it's oftentimes when I talk to people who are not familiar with the world of bioethics or clinical ethics, they don't even realize that this world exists, that there's ethical issues that can come up in the clinical setting, which is interesting. But once I begin to describe kind of these scenarios or instances that we get called into, it rings bells for people. It makes sense to them. They see commonality there. And so there's a lot of times where I or my colleagues would say this is a clinical ethics situation, this is an ethical issue, but someone who's outside of the healthcare system may call it something else, but ultimately it comes down to an ethics issue. So when we think about ethics issues within the clinical setting, right, some examples that come to mind can include things like do not resuscitate orders, so things like DNR, or even more specifically, the idea of giving someone CPR or not, right? Concepts of like advanced directives, so healthcare power of attorneys, living wills, decision-making, who makes decisions, how do they make decisions, when do they make decisions, the concept of capacity, and in contrast, the concept of competence and how they relate to each other and how they're different. issues with withdrawal or withholding of artificial nutrition or hydration, or even ventilation, things like organ donation and transplantation, and non-beneficial treatment, which you might in other contexts hear the term futility, but for our purposes, we a lot of times have now defaulted to using the terms non-beneficial treatment, a little bit clearer for folks to understand. This is in no way a comprehensive list, but these are really good examples of some of the things we would say are clinical ethics issues or ethics issues in a clinical setting. And I think what you find that is specific with each one of these is that you may not have a clear-cut answer every time you come to the table to discuss these. So you may have an opinion on how you would want this situation to be handled, or your loved one, but the healthcare provider or the healthcare team may have a different view, and patients and families have different views on these things as well. So in clinical ethics, one of the things we tend to rely on is case discussion and case examples. We'll see this a lot in clinical ethics discussions. And I think this case of the multi-talented motorcyclist is a great example. So let's think of a scenario where there's a man who's in his 40s and he is in a very terrible motorcycle accident. He was driving the motorcycle, and while the details of the accident aren't important, he is brought emergently to a trauma center. And they are able to get him to the point where they realize his leg has significant damage. And in order to save his leg, they actually are going to need to do some surgery on his wrist and remove some muscles and possibly some tendons and things, move it into his leg. They can then save the leg. His wrist might have some restriction in movement, but overall, he'll still have his wrist and he'll have his leg. And to most people, that seems like a reasonable decision to make. However, when the team goes and talks to this patient, he says, absolutely not. I do not want you operating on my wrist. Do whatever you have to do, except do not do any surgery on my wrist. I need my wrist to be fully functional. Now, at face value, that may seem strange. That may seem unusual to a reasonable person. Sometimes we talk about reasonable person standards. However, when you start to ask this patient why, we start to see a bigger picture. And what the patient shares with us is he's actually a concert pianist, and being able to have function in his wrists are vital to who he is, to his livelihood, and to how he sees himself in the world. And for him to lose his leg is not a significant deal in comparison to losing functionality of his wrist. And so you can imagine a world where most patients would choose to have the surgery on their wrist in order to save their leg. But in a case like this patient, where it's a multi-talented motorcyclist, he would prefer to save the functionality of his wrist and lose his leg. And when we take a step back from this case, one of the things we start to realize is that at the heart of this case is we're considering complex, value-laden issues. And that's really at the heart of bioethics and medical humanities in a clinical setting. So when we work through these cases, it really is a matter of working through these complex, value-laden issues so they can emerge in how we deliver and practice biomedicine and life sciences, how we approach patients, how patients make decisions as well. And so when we work through these cases, we're really working to identify, analyze, and resolve value conflicts or uncertainties that emerge. And so while the team may have one approach they believe is best, in talking to the patient and or the family, we find out more information that can provide a greater context. They can help us to identify, analyze, and resolve those value conflicts, which in the case of the multi-talented motorcyclist really is apparent once we know his career as a concert pianist. And then the last thing it really illustrates is that in cases, not just in the multi-talented motorcyclist case, but in all cases, it's important to study various approaches to bioethics and medical humanities because each approach can offer a different perspective. They can surface a different aspect to that complex, value-laden issue. And so it's really important that we think through these in a multifaceted way, multi-layered way with different approaches. And so that's something that's really important when we think about clinical ethics. And so kind of moving on from that, where do we go from there? So why study it? If we know that it's about value-laden or conflicts in values, value-laden issues, well, studying clinical ethics, studying bioethics and medical humanities is important because the healthcare industry, the healthcare system, obtaining healthcare, seeking healthcare impacts all of us, right? It could be personally, whether it's ourselves or our loved ones, or it could be professionally, whether we are in the healthcare system as practitioners or providers, or more on the outside as an allied health professional or working in health policy. It's going to impact us. And so there's a lot of things to consider, and it's important to study these issues. And so these constant advancements we see in science, technology, medicine, healthcare lead to big questions that are ethical concerns. We saw significant discussions and questions come up during the height of the COVID-19 pandemic, right? Should and ultimately can we intervene? What kind of values should inform policy and practice? Can we ensure justice and respect for persons in research and clinical practice? These are just some of the questions we can ask. There's a multitude of other questions that you can even imagine that also should be brought to light as well. So moving on from there, if it's important to study clinical ethics and bioethics and medical humanities, how does it help a career path then? And so I think it's important to recognize that bioethics and medical humanities is both interprofessional and multidisciplinary, both in its origin and its current practice. And so that allows for a lot of different voices to come to the table to bring their perspectives, to bring their unique lens through these discussions. And that allows this field to launch students in a multitude of career paths, which is really unique about bioethics and medical humanities. So for our program in particular, we see students from all different career paths, either returning to education or students who are looking to launch their career paths, whether it's clinical or legal professions, whether it's going into regulatory work, whether it's going into arts and humanities. Some of our students plan to go become full-time bioethicists or clinical ethicists or go into academia. And then one of the really unique features is that our program and bioethics in general allows for discernment for those who are undecided of their career path. You may be someone who says, I really am interested in healthcare, or I'm really interested in health law, but I don't know the exact path that I want to take or the exact career that I want. This field of study really allows you to be exposed to a multitude of opportunities, a multitude of career paths to explore and consider the directions you can go. And that's one of the things I love about not only our program, but the field of bioethics and medical humanities. So that being said, I just want to talk briefly about the program. So this past fall, this last week was graduation. And so we just wrapped up our 27th year of the program. It's very exciting. So this upcoming fall, we will be celebrating 28 years of the program. When students complete our program full-time, it's 1 year or 2 semesters. We do have part-time options. There are students sometimes who will take a 3rd semester. They'll do courses in the summer. And we can talk about, unique student situations, of course. We allow for a customized curriculum. So about half of our courses of the 30 credits are core requirements. The other half are electives. We have a variety of options within those electives, which we'll talk about in a little bit. But one of the biggest highlights that we have as our program is our study abroad. These are short-term courses. They're 3 credit hours. Students can travel over winter break, spring break, or in May. And they're 1 or 2 weeks. Students can travel to Costa Rica, the Netherlands, Spain. We've also done domestic courses to Yellowstone National Park or other national parks here domestically. So there's a variety of options for these short-term study abroad courses. Students also receive personalized advising. So each student in our program is assigned an academic advisor. We look to pair up students and faculty with similar interests, similar career paths, and we also have dual degree options. So for students who are interested in those, I'm happy to speak more with you in particular about those. But just of note, you have to apply and be accepted to each dual degree program separately. So to speak more about this curriculum, we essentially have 3 directions students can go. One is our traditional program, and then we have 2 concentrations that students can do, either medicine, society, and culture, or our research ethics concentration. For all of these directions, students complete Foundations of Bioethics 1 and 2, which is our core course that students take in the fall and spring. We have our clinical ethics rotations that students take. And then all students do a series of electives, and they complete a capstone paper in the spring semester. When you're in either the MSc concentration or the research ethics concentration, one of your elective slots is filled with the core course for that concentration. So there's a research ethics and regulations course, there's an MSc, a Foundations of MSc course that students take. In addition, there's many electives that are also related to those concentrations. What I like to tell students or prospective students that are interested in learning more about the concentrations or looking at the elective options, it's really about what you're trying to get out of the program. So think about where you are, where you'd like to be at the end of the program, or what your career path could potentially be, and choose courses that make the most sense to get you from point A to point B, right? From the beginning of the program to the end of the program or further on in your career path. And if the concentrations are the right fit for you, then that's the courses that you're going to pick. And so these are great ways for students to customize the curriculum in a way that makes sense for their particular career path. So to speak more specifically about our clinical ethics opportunities, we have our wonderful clinical ethics rotations course, which I'll speak in detail about in just a moment. We also have a clinical ethics theory and practice course. This course is a wonderful opportunity to really dive into the history and the theory of clinical ethics, where it came from, and also the current practice of it. And so you're not only hearing from the instructors who are teaching this course, but expert clinical ethicists, both in the Cleveland area and also potentially throughout the US, depending on the topics we pick for the class that year. Sometimes we even invite speakers on Zoom, depending on the topics. So we have a wonderful opportunity for students to really dive into various clinical ethics topics in this way. We also can learn from clinical ethicists in the classroom. They are a part of our faculty, and so they provide wonderful learning opportunities. Many of our faculty are not only teach, but they're connected to the clinical world as well. And then through your capstone paper, if this is a topic that you are particularly interested in, and there's a facet of clinical ethics that you want to write about, your capstone paper is a wonderful opportunity to do a deep dive into that area of research and work with a faculty reader that makes the most sense. So I've had the opportunity to work with students on their capstone papers that have clinical ethics focuses or foci, and other faculty have as well. So it's a really great opportunity for students. And then the other thing to keep in mind is there are research opportunities for students to get involved as well. So some of our clinical ethics faculty are always looking for students to join them in possibly a research project that's clinical ethics in focus. So there's ways for students to get plugged in as well. So one of our, I would say one of our biggest, if not the biggest, most significant reason that students choose our program is our clinical ethics rotations. This course is a hallmark of our program. All students complete the fall semester rotations. Most students complete the spring semester. The exception to that is the research ethics concentration students. They do a research ethics practicum instead. So the majority, by and large, the majority of our students do complete the 160 hours of rotations inside teaching hospitals here in Cleveland. For those who are doing the research ethics practicum, they do 80 hours because it's 80 hours per semester. So we have 4 teaching hospitals here in Cleveland. Cleveland Clinic is probably the most well-known. It's a private hospital and does a lot of research as well as significant clinical and patient care. MetroHealth is our county hospital. It's located on actually the west side of the city, and so it is a little bit of a drive, about 20-25 minutes, but it really is the safety net hospital for the region. It has a wonderful trauma center, emergency department, as well as a burn unit and other fantastic care that patients can receive. We have a VA here in Cleveland. The Lewis B. Stokes VA Cleveland Medical Center is actually the 4th largest VA hospital in the country. So it's quite an extensive hospital system that provides healthcare to veterans, both inpatient and outpatient. And as you can imagine from the population and the demographic they're seeing, they do a lot of orthopedic care, spine care, mental health care, geriatric care. There's a lot of research that also goes on there as well. And so there's a lot of opportunities for students who are interested in a variety of things related to that type of healthcare. And then lastly, we have university hospitals. This is also a private hospital in Cleveland. They have a large Rainbow Babies and Children's Hospital. So they do a lot of pediatric and neonatal care there. They also do transplants and neurosurgery. And so there's a lot to see at that hospital as well. So while students are in their rotations, they're assigned to a particular hospital in the fall semester and a different hospital in the spring semester. While you're in your rotations, you are going on morning rounds with ICU teams, going to general floor rounds. You might attend interdisciplinary team rounds and consult team rounds. You will be attending committee meetings like ethics committee, institutional review board committees, rehab committee meetings, animal research meeting, transplant selection committees. Each hospital is unique in the type of committees that it offers and the type of meetings you can attend. And then of course you get to go one-on-one with healthcare professionals, visiting patients, attending meetings, and you get direct time with healthcare professionals that understand ethics. So this could be going with and attending in an emergency department for an 8-hour shift. And of course, we make sure that it's a busy shift, like an 11 p.m. to 7 a.m. Friday night shift. Or it could be going with a chaplain while they go and meet with patients and families, or a social worker that covers pediatric hem-oncology. And so there's a variety of things that you will be doing with one-on-one with these healthcare professionals in their roles to understand how they interact with ethics as well. In addition to these opportunities, you meet weekly with fellow students and a clinical ethicist or an ethics committee member from that hospital to talk about what you've observed, digest, and really to work through the ethical issues that you've encountered for that previous week. You'll keep a log and journal of your time, and you'll identify 2 cases throughout the semester to do a case analysis on, and really to do a deep dive in a 3 to 4 page writing exercise. So these are wonderful opportunities for students. We work with students to identify the hospitals they want to be at, what areas of healthcare or bioethics, medical humanities they're interested in, and how best to assign them to the site that makes the most sense for their career path. So just quickly, for the application process, for those who are interested, our required materials include transcripts from all undergrad and grad programs, personal essay, CV resume, and 2 letters of recommendation, including one of a faculty member. Once we have your completed application, it's reviewed by an admissions committee member, and you are interviewed by one of our admissions committee members. This process, once we have a completed application, typically takes 2 to 3 weeks. We do rolling admissions, so we do try to go through these fairly quickly as we can. For those who are also interested, we have financial aid opportunities. Anyone who has already applied by our priority 2 deadline of May 15th is eligible for our student assistantships. This gives students the opportunity to get involved in teaching, research, or administrative opportunities. That application is due by June 1st. If you have not received your application, please send us an email and we'll make sure that you get the link to that. We also have traditional financial aid available for students, and tuition information is available through Graduate Studies Online. In terms of deadlines, the next deadline, as I mentioned, is those who are eligible to apply for student assistantships. The deadline is June 1st, so please make sure you submit by that deadline. But in general, anyone who's interested in submitting a master's program application, our final deadline is August 1st. If you'd like to join us for fall this year, for fall 2023, we will take applications all the way up until August 1st. I highly recommend you get your application in. The sooner, the better. The reason is because there's a lot of things that you'll need to get in place if you're admitted and then decide to join us, including if you're not local to Cleveland, finding a place to live and moving and getting adjusted and all of those things. And so we don't want you to feel rushed. And so the sooner you can get your application in, the better. So I want to take time if there's any questions that have been submitted through the Q&A. I'd love to be able to answer those. So at this time, if anyone has anything to ask, please feel free to submit them into the Q&A feature. I know we had some questions that were submitted ahead of time. And so I know one question that was submitted ahead of time that we often get a lot is, why choose this program in comparison to other masters in bioethics and medical humanities programs? And my response to that is not to disparage any other program, but it's really to highlight what our program does well. We are one of the oldest programs in the country. We have been able to really fine tune what we do well, like our clinical ethics rotations, our study abroad opportunities, our research opportunities for students. And because of that, students get a well-rounded graduate education through our program. Our faculty are involved in education and research. We make sure that students feel like whole people. And so we don't just view you as someone who is sitting in a classroom and learning. We make sure that you are doing well across the board. And so we want to connect with you and make sure you have the resources you need while you are here as a student, whether that's as a full-time student for your 2 semesters or a part-time student over several years. And so that's really important to us. And so I think that's something that our program does incredibly well. I'm looking to see if there's any other questions, and I'm not seeing anything else come in. But if folks want to submit any other questions or connect with us specifically about your circumstance, or want to talk about whether you're the right fit to even apply to the program, please feel free to email us, bioethics@case.edu. I'm happy to connect with you there and either set up a time for us to meet or connect you with the faculty member that you're trying to reach or the person that makes the most sense to answer your question. So thank you so much for attending the webinar. We hope that you learned something new today. And if you haven't submitted your application, I encourage you to get it in when you can so that we can review it and get you an admission decision soon. And we hope that you join us in August for the next academic year. So thanks to everyone and have a good night.